you cannot discount the impact of Project Fear on the public. When you're talking about this, when you're talking about people not getting the care that they need, or the NHS restricting services, or even implying that services are more sort of urgent because of COVID, you can't discount the impact on the public in terms of not taking up or being able to navigate through the new COVID-only NHS service. And the other thing that's totally disingenuous, that's being done by the media, that's being done by politicians, is they're keeping the taxi meter running on this. They're quoting death figures like 50,000. I saw John McDonald, MP, just did this a couple of days ago. 50,000 deaths, and we need to do this, that, and the other. First of all, the Center for Evidence-Based Medicine has already shaved that by up to 33%, just by looking at the death certificates in terms of attributing actual deaths to COVID. So you can cut that 50,000 in a third, and you can cut it off at the last season, because coronaviruses don't run like a taxi meter constantly, okay, to infinity. This is what they're doing. They're seasonal. You cut it off, this is a new season, okay? But they're doing this in America, they're doing it in the UK. Governments and political opportunists and public health officials are milking this sacred death total for all it's worth, and they'll just keep doing it. They'll have a 3-year running total, and they'll be quoting it and having, you know, it's like 9/11 anniversaries, you know, having memorials every 6 months. We've just reached this 1 million global deaths, 1.5 million global deaths, 100,000 COVID deaths. They'll be saying that in 2022 in the UK. It's ridiculous. That on its face is a complete fraud. Okay, and I think people in the media need to be more responsible, and they need to call this out, and they need to push back, because this is pure propaganda. They're totally misappropriating statistics, and they're totally distorting the actual picture that public should be looking at.